Hello, everyone. Happy Social Work Month. And thank you so much for joining us today. Welcome to the Social Work Leadership Roundtable Social Work Month event. We're closing out the month very strong, March 25th. I'm Darla Spence Coffey, the President and CEO of the Council on Social Work Education, and it is my honor to be able to serve as the MC for today's event. CSWE is really proud to be part of this leadership roundtable with other amazing social work organizations. Before we begin our event today, I want to thank the organizations and their teams that make up this group and who worked very hard to make this event possible. American Academy of Social Work and Social Welfare is represented by their president, Dr. Mary McKay. We've got the Association of Baccalaureate Social Work Program Directors, which is represented by their president, Dr. Catherine Gale. Of course, other members of my CSWE team, including Dr. Sandra Starks, who is the chair of the CSWE Board of Directors, and the incoming chair of that Board of Directors, Dr. Hillary Weaver. We've got GAID, the Group for the Advancement of Doctoral Education in Social Work Education, and the co-presidents for that organization include Dr. Julie Henley and Dr. Lawrence Farmer. The Grand Challenges of Social Work, chair of the executive committee of the Grand Challenge Initiative is Dr. Richard Barth. The National Association of Black Social Workers, represented by their president, Melissa Haley. The National Association of Deans and Directors of Social Work Programs, represented by their president, Dr. Martel Teasley. The National Association of Social Workers, represented by their CEO, Dr. Angelo McLean, and their president, Mildred Mitt Joyner. The St. Louis Group, represented by their president, Dr. Gautam Yamada. And last but certainly not least, the Society for Social Work Research, represented by their president, Dr. Sean Joe. We are so very glad to host this event to close out a really wonderful month celebrating social workers. This month and today's meeting is really about celebrating our profession. Educators, practitioners, and practitioners, I mean policymakers, and all the different ways that we contribute to our society. How appropriate that the theme for this month, Social Work Month 2022, is "The Time is Right for Social Work." Given everything that's happened to us, our friends, families, clients, and communities over the past 2 years, I would say certainly yes, the time is right for social work. We've had a global pandemic that laid bare the shortcomings and inequalities of our healthcare system, a reckoning with the pandemic of racism as communities speak out across the country and highlight systemic racism that has been part of this country's very founding. Lawmakers at the state and federal levels that weaponize misinformation and continue to push for state laws that attack transgender and LGBTQ+ children and families. State efforts to limit what can be taught in classrooms. And now we face the horrors of war as Russia continues its month-long war on the people of Ukraine. There's a whole lot going on. Yet, as you'll see and hear today, this is absolutely the right time for social work. These events and these trends present opportunities for social workers to make real progress on our commitment to social justice at home and abroad, and the well-being of our clients and communities uppermost in our minds. Today, we will hear from some panelists who I'm very, very grateful for their willingness to participate in this event about why the time is right for social work. But earlier this month, we launched a campaign through our various social work leadership organizations to ask members, to ask students, faculty, practitioners, why the time is right. Show us through photos and videos. Tell us through poems, essays, scholarly research, and more. And you responded, and we thank you very, very much. We're glad to share with you in just a few minutes just a sample of the conversations, quotes, and content that you shared with your fellow social workers and educators. We have a wonderful panel of educators and practitioners with us today to talk through the content that you shared, and I'd like to introduce them now. First, Yarneccia Dyson. Dr. Yarneccia Dyson is the Associate Professor and Department Chair of the Social Work and Gerontology program at the University of North Carolina, Greensboro. Dr. Dyson is an equity-minded thought leader committed to inclusive excellence and social justice. As a social and behavioral scientist, she engages in health disparities research that focuses on reducing and alleviating negative health outcomes by empowering marginalized communities through implementation science. Dr. Dyson has more than 15 years of social work practice experience in various roles, including social services administrator, research analyst, and public health analyst. Dr. Dyson was the most recent recipient of the CSWE Award for Early Career Faculty Service and Leadership in Social Work Education. Welcome, Yarneccia. Next, I'd like to introduce you to Suki Kim. Dr. Kim is an associate professor and site coordinator of the Public Child Welfare Certificate State Program at the School of Social Work at Northern Kentucky University. Dr. Kim is also a faculty fellow for the Institute for Health Innovation at Northern Kentucky. Dr. Kim is a proactive scholar, researcher, and educator in gerontological research and opioid addiction studies. She developed Northern Kentucky's transdisciplinary approach to an aging-specific curriculum, and with her colleagues, guided the creation of Northern Kentucky's gerontology and social entrepreneur micro-credentialing programs. Welcome, Suki, and thank you so much. Oh, I forgot to mention, Dr. Kim is also the most recent recipient of the CSWE Award for Distinguished Recent Contributions to Social Work Education. Next, I would like to introduce you to Xander Keg. Mr. Keig is an award-winning social worker, published author, and public speaker. He is an advisor to the Foundation Against Intolerance and Racism and senior fellow at the Institute for Liberal Values Diversity Director. He is frequently sought after to facilitate workshops in the US and internationally on corporate emotional wellness and personal growth. Mr. Keig is a US Coast Guard veteran. My father is also a US Coast Guard veteran, Zander, and always feels a little slighted because the Coast Guard doesn't get nearly as much attention as other folks within the armed services. So thank you for your service. You've worked as a homeless outreach social worker and as a senior social worker for the Department of Veteran Affairs in the Veterans Health Administration from 2012 through 2016. Xander Keg received NASW's 2020 Social Worker of the Year Award. Thank you for being with us today, Zander. And last but not least, I'd like to introduce you to Kimber Nicoletti-Martinez. Ms. Nicoletti-Martinez is the founder director of multicultural efforts to end sexual assault and also serves as the Latinx farm worker outreach coordinator for both the national and Indiana agribility projects at Purdue University. Ms. Nicoletti-Martinez has been an advocate for Latinx immigrant and farm worker communities for more than 25 years. She was named the NASW Social Worker of the Year in 2018 and awarded the 2017 Indiana Social Worker of the Year by the Indiana chapter of NASW. She was also the recipient of the 2021 Jefferson Award for Outstanding Public Service by the Multiplying Good Foundation. She is a licensed clinical social worker in the state of Indiana, and we really welcome you, Kimber. Thank you so much. So thank you again to all of our featured panelists. We'll be sure to introduce our other speakers as the event goes on. And now, the world premiere of the Time is Right for Social Work multimedia presentation, which you'll be able to find in several places afterwards. It's going to be on the NASW Facebook page, as well as the CSW website on the YouTube channel. So look at it here and then feel free to revisit it and share it with your friends. Greg, if you would tee up this.
give in to hopes that were dashed or dreams interrupted by greed and fame. At the end of the day, remember the penny that still looks brand new because it did more than just merely survive. At the end of it all, I will live fully. I will love well. As I rebound, I am more resourceful and strengthened through adversities, and like the penny, I shine.
I'm able to merge public health and social work together. That's my perfect world. I plan to retire in the public health service. I'll always be a social worker. I'll always be a public health service officer, and I take great pride in both of those. I'm Jamila Bynum, Lieutenant with the Public Health Service. I'm also a social worker serving in the role as a team lead for the case management team here in the TCF Center in Detroit, Michigan.
Makes this the right time for social work is to think about what are the unintended consequences of the technologies that are being developed for this kind of stuff that social work does around addressing equity, around addressing economic and environmental and social, political injustices. So I absolutely think that the time is always right for social work, particularly when it comes to technology.
Wow, that seems so inspiring. Thank you so much, Greg, for helping us out with that. And thank you again to everyone who submitted content for this particular project. We couldn't use it all. There's some fabulous things that we have been submitted. So please take a chance to check out the CSWE Spark and or the My NASW to see more of the essays, photos, videos, and more that were shared. Thank you again for the panelists. And now we're going to just turn things over to you. I've got some questions based on what some of the folks contributed to our video, but you'll also get a chance to kind of opine more broadly about why the time is right for social work. So first, if I could just ask you, Suk-hee, what is your initial reaction or thoughts after seeing the video?
Thank you. What an honor to be sitting in this roundtable this afternoon or in the morning in some other places that you are joining with us. If not right now, if not now, then when? I would like to open that as an answer to that question that I watched this video. It's such an inspiring to me and hopefully inspiring to you and to my colleagues around the nation. In this video is actually reflecting what the truth about the social work. We care for humanity, we care one another, and also we care the struggles that we have daily basis. And I believe that this is the right time. As I mentioned, if not now, then when? And so it is a perfect time to unpack who we are as a profession in social work and what we are doing daily basis.
Thank you so much. Zander, anything that the video prompted for you?
Of course. My first thought is to really appreciate the work of Lieutenant Bynum, working with the Uniform Public Health Services Corps. That's quite a commitment that a person makes to serve alongside our military branches of all kinds, including the Coast Guard, of which I'm a veteran, and also working not only for the Department of Veterans Affairs with our homeless veterans population. I also worked with the U.S. Navy at Balboa Naval Hospital in San Diego. So I'm always wanting to not only recognize, but hold up all of the wonderful social workers who choose to go to work working with our military and our veterans. The military and our veteran populations, those settings are probably the number one producers or providers of internship programs for social workers. So they're wonderful places for people to learn. So for students out there, please do consider those sites for your internships.
Thank you, Zander. Kimber, I'm going to ask you if you would also comment on what the video just spoke to you about.
Well, I just felt so inspired and uplifted. So many pieces of that video really raising the voices of Indigenous and BIPOC people and the needs across those communities. I love some of the creativity that social workers brought to that, so many different levels. But I especially love the poem, and I like to think that just like the penny, it really is time for social workers just to shine.
Well, thank you, Kimber. Yes. And Yarneccia, was there anything in particular that spoke to you from the video?
Sure. The one thing that spoke to me from the video was just the importance of the pursuit of social justice across all of our different social identities, our communities, our areas, and why more than now than ever, as Suki said, it is truly the time for social work to, advance all of these goals of each of our professional organizations or agencies and ensuring that we're supporting each other in doing so.
Great. Thank you so much, Yarneccia. So the next question that I'm going to ask the panelists is about the video, but it's also just more broadly. So I'm going to just try and mix things up a little bit so that we all don't go in the same order. Kimber, if you would like to say what makes living through the COVID pandemic the right time for social work?
Well, living through the COVID pandemic, a lot of my social work practice involves work with immigrant, refugee, and farm worker populations. And we saw immense amount of disparity in terms of testing and treatment and services for farm worker communities, which are essential workers and continue to work through the pandemic. And it really is the right time for social work to advocate for the needs of the most vulnerable populations. Well, a lot of times there's so many barriers. Some of it's geographic, some of it's just looking at documentation status for willingness to provide treatment. I know I'm kind of getting into the medical thing, but really COVID really showed that a lot of people didn't have access to vaccines. We did a lot of outreach work trying to provide masks and educate people about vaccines and organizing with the Department of Health to get mobile vaccines out to farm worker populations, but also the immense amount of stress and mental health issues that created for those vulnerable populations who also weren't eligible for some of the financial stipends that were provided. And it's just a great time for, it's the right time for social work to be involved on all levels in terms of policy, advocacy at the community level, creating access. So, gosh, I could talk all day about that, but
Thank
thank
you
you
so
so
much,
much.
Kimber. Absolutely. And thank you for the good work that you talked about being a part of with the masks and contact tracing and so forth. Incredibly important. Being named an essential worker during the pandemic, I think, was really important to raise the value of social workers. So from your vantage point, Suk-hee, as a social work educator, what about living through the COVID-19 pandemic drives home that now is the right time for social work?
Go through pandemic, it creates a lot of a different way of helping and serving individuals, families, and groups and communities, including global communities. I have been working with all the other populations with the music as a non-pharmacological interventions at the nursing home basis. And this is such a time to revisiting how our individuals and families' presence in a setting so valuable than any other times that we went through, which we value more about individuals contact one another, that I never ever thought that the being with people and being around with the people. And I believe that that was such a gift that I have not valued more before. So through this pandemic, I believe that we are in a new era and we are in a place to look back at what we had as so much gifted to each and every one of us. So I believe that through this pandemic, we want to know more about the personal interactions, even including technology that we wanted to unpack a little later. But through this pandemic, we know that the importance of the people's presence and displaying individuals' struggles and also suffering. And we want to join with that suffering. And I believe that we taught by the COVID-19, we know more and we know better how to join the suffering that what we have been seeing and what we have been exposed to everyone in our communities.
Oh, well, thank you so much, Suki. And Yarneccia, I realize that you and Suki have some definite like shared interest. You're chairing a Department of Social Work and Gerontology, and we know that the older population also got hit really hard with COVID, and wondered if you could talk about the role that social workers have had during the pandemic, the COVID-19 pandemic, and why the time is right.
Sure. So when I think about your question, I think about Fannie Lou Hamer's quote that nobody's free until everybody's free, right? And she also mentioned that she's sick and tired of being sick and tired. And I think about Dean Sandra Edmonds Crew, the Howard University School of Social Work Dean. She gave me some advice not long ago, and she reminded me of the words of Annabelle Lindsay Burns, who was a founding dean of HU Social Work. HU, you know, to our alumni that's watching. But Dean Annabelle Lindsay Burns, she's a social justice warrior, and of course, she's an NASW pioneer. And she always emphasized the importance of taking social justice in everything that we do. So I think that the time is right for social work because we have to acknowledge the racism that's happening in the profession as well as outside of the profession. And in order for us to do that, we'll then be able to advance equity and inclusion and belonging. So despite anybody's social identity, despite where they are, people are automatically able to show up as their full and authentic selves in everything that they do. And the social workers, practitioners, educators are able to serve them where they are, and of course, use their lived experiences to tailor interventions, research, practices to guide their work. So it also means that we are in need of our accomplices, not allies, but the accomplices, the people that are willing to speak up about injustices that's happening in order to use their power and privilege to advance all of these topics that we're talking about. So those are some of the things that I think about, some of the quotes, some of the foundational social justice pioneers that we need to think about considering, and not even moving from consideration to mandating, really, because at this time, the time is right for social work to make things happen. No longer an option, but something that we have to do in order to advance social justice.
Thank you. And I am going to remember to think about accomplices and not just allies. I've also heard co-conspirators, which resonates with a certain radical rabble rouser in me.
Yeah.
No, but yes, being more than just sort of supportive on the side, but really active partners in changing the system in the ways that it needs to change. Xander, what do you think? What are your thoughts about living through this, COVID pandemic, and why that makes this the right time for social work?
Well, I think that social workers rose to the occasion. I mean, we're flexible. That's our jobs sort of demand that in many ways. We're quite responsive to the needs, not only of people, but of the situation, the circumstances going on. And I could tell you that as of March 13th, 2020, I moved over to telehealth, and I know a lot of people did too. And so we were quick to find ways to meet the needs of all the clients we were working with. I was working with the Cohen Veterans Network, specifically with veterans and their families and military families. And we didn't skip a beat. We learned exactly how to work with people across the entire state of Florida. And I know lots of social workers did that. Medical social workers, case managers, social service social workers working in the homeless sector, in nursing homes. They had to find a way, right, to be able to provide those services, whether it was an essential worker on site or an essential worker at home. And we got the job done. And I think we're still getting the job done.
Thank you, Zander. And, that makes me think about the contribution from Dr. Jonathan Singer about technology, and the time is right for social workers to be really leading in that space and making sure that we are able to take advantage of various technologies, but lead with our social work perspectives and our values, not like technology change who and how we do things, right? Who we are and how we do things. So Yarneccia, I'm going to ask you to kick off the next question, because we've also had another pandemic that has been named during this period of time. And it's really about the, recognizing the systemic racism. So what are your thoughts for why recent increased racial tension or attention to the racism shows that it's the right time for social work?
Sure. I think that it's always been there. It seems like it's been increased because we have more of the technology that we've been talking about today. I believe that people are also, it goes back to Fannie Lou Hamer's, we're sick and tired of being sick and tired, and it's time for things to happen and change. I believe the increased racial tension definitely reflects that there's also some things that are happening within our social work programs that are preparing practitioners in order to intervene. And so if these discussions are not happening in our systems of higher education to talk about dismantling the structural racisms, dismantling even practices that are embedded within the ways, fibers of programs and how they're developed, how they're implemented, who are graduating, this is why social work has to address all of those things and reconcile with its history. And that's the other part, is that social work, I don't think that we've truly sat with our history and how it was founded upon, racism and sexism that have happened. So as we continue to move things forward from an educational aspect, so we're graduating practitioners as well as those that are future educators, we have to reconcile why these tensions are increasing and how we then intervene so that this doesn't continue to happen again.
Thank you. And, I've often thought of that quote of being sick and tired of being sick and tired. It feels to me like we've got to figure out a way to also find our reserve tank, right? Mm-hmm. Because now is really a great moment to, if we're there, if we're committed, if we're strategic and intentional about all of this, I mean, to some extent, the system, and I'm going to talk about it as if it's a person right now, so bear with me, but the system might depend on our weariness and our fatigue. And if we slip into that entirely, then we're not going to be able to take this moment and really create the kind of change that we're talking about. But we can't do that alone.
That's right.
So of course we're tired, and we're tired of being tired. And that's why we really need to band together as peers, as professionals, as colleagues, as accomplices in this work.
Absolutely. One thing I'll add to what you just said, Darla, is we also need to prioritize self-care and rest. I think that a lot of times in social work, we feel like being so busy or doing a lot is a badge of honor, when it's also, increasing the allostatic load on the body. Allostatic load meaning, that constant wear and tear. So for some people, those of us that have historically oppressed identities, marginalized social identities, that wear and tear looks like chronic health issues. It looks like time away from family because we're so stressed out from microaggressions and macroaggressions that we can barely even, think to move. So it's also social work prioritizing what self-care looks like. It's prioritizing when Audre Lorde talked about that self-care needs to be radical in order for us to replenish so that we can continue to do the work. And then back to your point too, leaning on our accomplices to also speak up and speak out about injustices. So, not seeing how someone treats a certain client and after the session is over, coming to them and saying, that was really awful what happened to such and such client, but also addressing the social work, that was awful what you did to such and such client, because it doesn't advance the NASW code of ethics and our core values for the profession.
Yeah, excellent point. Thank you, Yarneccia. Kimber, what do you think about why the time is right for social work in this period of racial reckoning and really understanding the deep roots of our systemic racism, colonialism, and white supremacy that we've had?
Well, first I have to start off and give a shout out to Dr. Dyson, because I just was so educated there by her comments. I was like, yeah, I remember when I first started my master's program a few years ago. I guess it was 1998. I guess a while ago. But at that time there, I think that there was only one other Latinx person in the program and 2 African American students. And so I came out into a profession that was, I was othered in, right? And was often considered an addendum to things. Even when we start talking about things like social work ethics, because it often looked very different in immigrant and Latino communities and across different communities. But it was always kind of like, I was just this side discussion, right? Or a token discussion. And often didn't feel at home in my own profession, even though I remain committed to serving the communities that I serve. And I take it up to now, and with the structural racism, I see so many young people in so many different communities really speaking out and organizing. And I think it's a beautiful thing. It looks amazing to see people speaking out. And for myself, I was a survivor of violence, and it was hard for me at that time to speak out and say, hey, this isn't just an add-on piece, right? This is people's realities, and we're talking about something that's systemic, and we have to create space and that space has to change if we really want it to be inclusive, right? So for me, I think it's the right time for social work to really look at itself and look at how we can change the space so that it genuinely is inclusive and not just sort of an add-on piece to say, this is this other group, and really connecting that with social justice and racial justice. It's a great opportunity for social workers to organize in their communities and help support young activist groups. Because I really think of social work at its roots was something that was founded on activism. And through the years, a lot of people just became professionalized and into being mental health clinicians. I went into my master's program wanting to be a macro social worker, but they said, hey, you need to go ahead and take the micro thing, so because you might need that. But then I've continued my whole life really just to do macro social work. And so a lot of times when students come to me and they say, what can you do with a master's degree in social work? And I said, you want to be an activist, you want to change the world, it's the right time for social work to really pick up that gauntlet again.
So, Kimber, you said so much in your remarks right then. I just really want to thank you, and to tag on to something that you led with, what you learned from Dr. Dyson. I mean, that's one of the things that I've really taken away from the last couple of years is how much I've learned from, other members of the profession, the folks that are leading from behind, so to speak. It's just been a fabulous way to really bring in new voices and new perspectives, and what an opportunity to learn. And I really think about social workers' commitment to lifelong learning in that space, and how critically important it is that we don't sort of settle into our quote unquote professional roles, but that we continue to live on that learning edge. So I just really want to thank you for that.
Well, thank you.
Suki, do you have anything that you would like to say about what your observation has been about social workers' role during this time of real racial reckoning?
I believe the voice was always there, but not many people is willing to listen. And I like to start with that because, with my respect, that this is a time to unpack difficult conversation. And this is a time to listen to who are hurting. And this is a time to say that what I did wrong, or this is a time to listen what they have to say to all of us. So the voice was there, but we have so quick to talk, but so slow to listen. How about we can shape and redirect the paradigm that what if we are quick to listen and slow to talk a little bit? Maybe that brings some unifications, that brings a room to be heard. And also, how many people, including myself, is willing to join the people who are hurting? Because we, in our life journey, always have a struggles in there. And I see that as that's the beauty of the journey of our individual life, of our family lives, of our community lives, and of our global journey together. As you see in a video, the vessel, broken vessel. The beauty of social work is to bring the glue, the gold glue, to bring the bridge between the cracked places. And what if we seeking for the cracking place, the spot, daily? And I think that the people are more drawn to the social work profession because we have a beauty to be willing to be a partner with a cracking community spot, cracking in our own individual's life journey. So I like to bring some attention, including myself, to quick to listen and slow to talk. And also the beauty of social work is action-based. We want to do some action to it, not just to sit and talk, but also the action has to follow through. So we can present and display what does the love and care look like daily through our own actions. And I believe that that is a beauty that we want to contribute to our society and to our own community in our own backyard. So,
well, thank you so much. I do feel like we, if we're open to it, there's been lots of lessons for us to learn during this period of time. And one is definitely about listening and listening to understand, which is not the same as listening to figure out how I'm going to respond, which is sometimes what we get into. just really slowing things down. But I also want to draw attention to what you said about, identifying those cracks. And it reminded me of something in the video. There was somebody who contributed something about the Japanese art of kintsugi, which is a way in which we fill the cracks with gold and make it even more beautiful and stronger as, than it was in the beginning. And I just think that's a beautiful metaphor for us and what we can do with each other and for each other in this space. So Xander, how about you? What have you thought about the role that social work has played and needs to play in leading during this period of time where there's been some real conversations, critical and honest conversations about systemic racism?
Well, there's not much to add. I mean, so much has been said, really wonderful things. What I will add is something that I consider to be a really powerful act is role modeling. And I think that we're doing that right now. If you think about it, the four of us are award winners from NASW and CSWE, on first generation Mexican heritage, right? And you can tell, based on what other people have shared, that we represent those communities that we're talking about have historically been, set aside, marginalized, mistreated, oppressed, all those different things. But contemporarily, I'll add that, social workers are, if not exclusively, at least primarily, the service providers of social care, right? And social care looks at the social determinants of health. Right. So there's historical aspects to that, and there's also contemporary aspects to that. But where our lens in particular lends itself, right? Lens itself, sorry to repeat similar sounding words, to being able to see people through that more holistic perspective. And there aren't very many other, I talk to professionals of many different kinds, and I don't find that they have that same lens that we have. When we do our comprehensive biopsychosocial assessment, we really get to know about the person, about their family, about their history. And I think that tool, right? So we're modeling it here, but also that tool that we have, the biopsychosocial assessment, I think can be used to elevate people's lives in significant ways if we take the time to really get to know what their experience has been and what they need. Right? Not what we decide they need, right? Not being prescriptive, right? But being elicitive, finding out from them, what do they need? What do they want? I noticed in the video you showed specifically the picture that was talking about Indigenous lives, and it said something like respectful helping. I think that was the word, right? Right. Making sure to take a point to recognize that there are people who need help. People need assistance. People need a hand up. People need a help, a warm handoff, whatever they need, the linkage, the brokering. But we can do it respectfully, right, without looking down on people. And I think too many people throughout history, at least working with social workers, myself, even as a young person, I felt looked down upon, right? And so I think we can find a way to be more eye to eye with people, right, as their partner clinicians, perhaps. Partner providers.
Yeah, and that's something that I feel like we need to create enough of a pause in our practice to make sure that we are centering the other, that we're there alongside to assist and not to direct, that helping is a partnership more than anything. And so I really appreciate that you bringing those thoughts and those concepts into the room as well. Just want to pause and say this is a fabulous conversation. I feel like we could go in lots of different directions. We do have a few more questions that I want to get to. And then, of course, there's been folks that have been, saying hello and making comments and asking questions of the panelists. And so we want to make sure that we preserve time to do that as well. So the next question I wanted to ask, because this was also something that was invoked in the video, which was, mentioning that social workers need to be at the table in DC and at the state and local legislatures to really advocate and set policy. So the question here, and I'm going to start with Suki, is, what makes this the right time for social work advocates for social justice?
As you mentioned that we were invited to the conversation table, federal level or the capital. I think that we are not satisfied just for that. Well, it may be we are the hosting the conversation and drawing the people from everywhere in us so that we can create a room for a way to figure it out, whatever the issues might be, whatever the answers might be, and best choice for the people and individuals as an option for them to choose for themselves. So this is the right time for the social justice. I believe that social justice never happened without understanding, without communications, without willingness to work one and another. So this is a social justice that we come up with a very, very different definition of social justice, belief, and also our own values that we stand for. But the social justice is bringing people and no one left out. And we are inviting them to our table, and we are willing to work and creating a room for the best options for everyone. So I think that I will stay with this social justice is the right time. As I mentioned earlier, this roundtable, if not now to bring the social justice, then when?
Thank you so much. I love you bringing that question back to us again. Like, if not now, then when? Like, this really is the time for us to step up. Xander, I've left you at the end, so I'm going to ask you now so you don't have to feel like everything else has been said, but particularly in that policy space, being at the table at federal and states or local legislative tables. What role do you see? Why is now the time for social work to be in that policy space so that we can advocate for justice on a different level than we have?
I think a primary reason for that is because we're on the ground with the people more. Right. So we're not only hearing the stories, we're actually working side by side with individuals who are trying to build something. They're struggling, they're studying, they need assistance economically, they're having health issues, right? They're caregivers for somebody with dementia. I'm the family caregiver for my father with dementia. And, I'd like to be involved in advocating for, caregivers to be somehow compensated, at least tax breaks, right? And so being able to bring in social workers who are working with so many different people across so many different sectors, we bring not only our lived experience, but we can bring the lived experiences of our people. We can bring them with us. We can bring their written words. We can bring their recorded voices, just like we did to start this off. We had a video where we shared people's experiences. We can do that in those settings as well. I think it helps when you're working to make decisions about things that are going to affect people's lives. You should know whose lives they're affecting and how they're going to be affecting those lives. And you can't do it from on high. On high is where you make the decisions, but from with the people, down on the ground, that's where those ideas need to be coming from.
No, I really appreciate that. Too often, and even when the policymakers are really good, they've got good intentions, they're so far away from how that policy is experienced by the individuals, families, and communities that we work with. And so closing that gap and making sure that we inform policy so that it really is affecting the kind of change on the ground level, as you say, or, with the folks that we're working. And that doesn't happen often enough. And that is a gap that social workers can and need to step into. Now, Kimber, I'm going to turn things over to you. I'm probably not needing to say anything because you've already let us know that you're a macro social worker. You kind of think about the policy implications of our work. But I just wonder, what has your experience been and why do you think we need to claim this moment as the right time for social work in this policy advocacy space?
Well, I can't think of a better time. And if it hasn't happened before, it should now. When I founded the program MESA, it was the idea, like Dr. Kim was saying, of inviting people to the table. And one of the things that we do in farm worker community is we educate them about policies and how policies impact things in their lives, like sexual harassment on the job, exposure to pesticide, among many other things. And so we are a part of the Alianza Nacional de Campesinas, the National Farm Worker Women Alliance. And we've organized groups of farm worker women to take them to DC to teach them how to go around and reach out to representatives, to make, presentations, or to, march, or, how to approach people, because it's so important that also for people that are those decision makers that are creating policies, they are disconnected from the communities, but why, right? So how can we get them more connected? How can we help those people that are making those decisions become familiar with the needs? I mean, a lot of times I'm reaching out to people because I live in Indiana, that their answer is, I know what their answer is going to be before I call them, but we still contact them because I said, do you know about this? And I've had people that you would think typically wouldn't support farm worker issues, and you're able to gain that influence. And it really shows that as social workers, we have the opportunity to reframe things, or what I like to say is translate, so that they understand it in their language, right? Like why this is important, and maybe how to reframe it to look at it from a different point of view. Because these policies impact, I mean, just look back at, the policies around refugee children being put in detention centers. What a horrible, horrible policy, right? So it really is an opportunity for social workers. It's the right time for social workers really to get in there and create sustainable change that impacts future generations. So thank you.
Well, thank you, Kimber. And I could go on with an individual conversation with you. I just loved the way that you brought in some very concrete social work skills that you use in your policy work, in your organizing work. So reframing, coming up with a common language. I like the idea of translating, which is something that we do in lots of our different spaces, right? Like, there are different professions and segments of our society that are very, very wedded to their own language and way of talking about things. And sometimes social workers need to be the ones to go in there and build those bridges so that we can all be talking a common language. Yarneccia, I'm going to turn to you. And if you wouldn't mind putting on the hat of somebody who is chairing a social work and gerontology program. So you're intimately involved in preparing the next generation of social work practitioners. So why is the time right for us in social work education to make sure that all of our social workers are prepared to understand and act in this policy space so that we can be effective advocates?
Sure. I think the right time for us to do this with our future practitioners is because we don't want to repeat the cycles that's happening. So we don't want to see a repetition of the last, 400 years. We think about 1960, which is not very, very long ago. And so in order for us to do that, we have to, change policies now. One thing that I appreciate about NASW, and specifically Madam President Mitt Joyner, she's having those essential chats with Mitt. It goes back to the very basic generalist intervention model. First step, or the plan change model for some of our macro folks, is engagement. If we are in a space to constantly engage conversations about the importance of social justice, if we're engaging about why we need to, be better advocates, as well as, upholding our core values, if the conversation is consistently going, then we won't be responding in times of crisis because we already know what we need to do. And so for having those discussions with our future practitioners, as well as embedding that even within ourselves as academicians and leaders, we won't be responding in crisis, but we're already proactively addressing things, as well as knowing when we interact with our clients and who we're advocating for, we're not going in and telling them what they need to do, because people are the best authors of their own lived experiences. So we have to tailor things based on their lived experiences.
Amen. Thank you. Thank you so much. Now, there were some comments within the video, and I know that you're astute observers of our environment, and there's lots of things wrong with our current healthcare system. And the COVID and racial pandemics that we've been talking about really shed light on the disparities and inequities that have been built in to our healthcare system, which makes us feel like now might be the time for social work to really be in that space. What is it, Suki, if I could start with you? What makes this the right time for social work to solve these issues within our healthcare system?
Appreciate that question. The healthcare system, it is ongoing challenges that we face daily. And our community actually having a very hard time to comprehend about the healthcare system we are in. That doesn't mean that we can stay as it is, but we needed to advocate the healthcare system, what works and what does not work. So it takes a place in a community collaborations and the broken system, then finding the broken system in that area, wherever you are in. So one of the examples of my research that related with opioid addiction and substance abuse in our community. And it is a long journey of the struggles in our community. People are dying even now in this moment. And so we are not talking about the issue that somebody else, some other backyard, but we are talking about opioid addiction or any type of substance abuse with the mental health issues that are going through at this moment. So the time is right to rescue at this moment struggles and the crisis that we are in. So healthcare system with these addictions, including opioid, we try to navigate to bring the people, law enforcement, and any type of community leadership. What I'm saying is the faith-based institutions need to be in this table, as well as non-profit organizations and the profit organization, including institution like where we are in our university, because the university, as an example, there we are in the community and the community belongs to our universities, and we needed to come in a way to find and figure it out about this is such a time issue, opioid, and people are dying daily basis at this moment. So the healthcare system that cannot resolve with just a solo player, it has to be a collective play. Collaboration needed to take in place, that we needed to be invited ourselves to the table, as I mentioned earlier, that the healthcare, that if any other nations are working very beautifully or any other community works well, it is a time to listen what works for them. Then why don't we practice and adopt those models to figure it out whether that works for our own community members, a community family that we are in. So the healthcare issue with the addiction specifically, that we have a long way to go. However, we are better now than yesterday because we are beginning to think about what's the best way to practice. What is the evidence-based practice telling and teaching us to adopt and adapt and create it and be innovative? So that's one of the examples that I like to put it into. And I think we needed to talk a little bit more and further.
Well, thank you, Suki. Like, there is no question that more folks are really seeing that we need to have an integrated approach to health and wellness. You know, that's a different, we've got a sick care system. People have said that for years. We don't really have a healthcare system. We have a system for some people to get help when they're sick. And through, the Affordable Care Act, more people have had access to healthcare, which is fabulous. But the other promise of the Affordable Care Act was to change the healthcare system that people would access. So we've increased access. Not that we're done there, because we still need to be working on that, but we really haven't had an opportunity to think critically about how to change the system. Zander, I'm going to toss things over to you. You mentioned the importance and the role that social workers have in bringing into social determinants of health. And that's been a big big conversation when we talk about healthcare these days. So what makes the time right for social work within the healthcare system in that regard?
Well, I'm optimistic that we're heading in the right direction in getting social care identified, distinguished, and applied CPT codes to it, right? So then there's going to be reimbursement. And my hope is that what happens after that is that social workers are going to be added to all these multidisciplinary teams so that there's a social worker available to the team, versus right now you might have one social worker for 3 teams, 4 teams, if there's even a social worker available, right? And so that's mostly right in a hospital setting, clinical setting. But there's a lot of different ways that we can go with this. I'll just speak personally as a trans man. Trans healthcare is something that's important to me. I access it all the time. I work as a trainer with behavioral health specialists wanting to be gender therapists. And I can tell you that when I'm talking with providers, with clinicians, with patients, with clients, what I'm hearing over and over and over again, and I've experienced this firsthand, is that there's hardly any social workers involved in a lot of that work within the transgender care and surgery work specifically. There are hardly any social workers on the teams. They might be licensed clinical social workers doing psychotherapy, but I'm talking about more the medical kind of social worker, the clinical case manager on the team, the one who's looking out for the social care, not just the physical and the behavioral care of the patient. And so my hope is that with these CPT codes coming online, that these mostly private care and surgical centers are going to find their way to bring in these social workers, because they'll be reimbursed and they'll be able to pay them. And I think that that's going to make a significant change for members of my community in particular.
Wow, there's so much that you said there. Having social workers on the team and interprofessional collaborative care is essential. And you mentioned, the role that social workers have in social care. It made me think about the consensus study that many of the Social Work Leadership Roundtable organizations that I mentioned earlier were really instrumental in getting the National Academies of Science, Engineering, and Medicine to fund and conduct a consensus study on why it's so important to integrate social care into the delivery of healthcare. And so, it reads social work from front to back. And I know that there's lots of other professions that are wanting to act more like social workers. And our message sometimes is like, just make sure there's a social worker on the team. I don't need my surgeon to act like a social worker. I need my surgeon to have a social worker partner, right? Yarneccia, what are your thoughts about why the time is right to solve our healthcare issues today?
Sure. I just want to piggyback everything everyone has said. I think that the time is right is that we have people's attention, right? But we also, social workers bring a unique lens to any environment that they're in. So while some professions may see things as just a black and white issue, we're also able to see the issues behind it, what colors it in. So we also understand that a person's intersectionality, their different social identities will affect the way they respond and why they're even in the healthcare setting. I think that it's the right time for social workers because we have everyone's ear and attention right now. And so we need to utilize our power and our privilege to advance these conversations forward while also interrogating our own practices and dismantling our own systemic and structural racisms in our programs and organizations as well.
Okay, I just need to take a deep breath. Use our power and our privilege. Yes.
Yes.
Always, right, Kimber?
We have to. We have to.
Kimber, what are your thoughts about why the time is right for social work to really step in and lead in changing the healthcare system that we have?
Well, first, I just want to slow clap for the people that were before me. I'm like, yes to all of that, right? I mean, for me, even though there's been a lot of changes, I think the right time is for social workers to really still look at culturally affirming healthcare and to recognize that mental health is health. I know that there have been a lot of changes around that, but there's still lots and lots of barriers. And there's a lot of mental health deserts now. You know, I do a lot of work also around, food access and people that are food insecure, but it seems like there's an intersection between food insecurity and access to healthcare, which would include mental health care. I actually here where I live, one of several of the large providers have retired, they've shut down. And so people in the community that don't have insurance have really, really limited access to healthcare and mental health care. And then what is available is not very culturally affirming or respectful. So people just kind of have to go in there, and it's framed in a way that doesn't meet that community's definition of help seeking or their definition of how health is viewed. And the communities I work with, it tends to be synergistic. And so it's not separated out. It's not the Zoloft commercial when the rain's happening and you're crying. It's their overall health. And I think of this woman many years ago who rubbing her legs was just sure she had cancer. And she said, I have cancer. And the people, I was a medical social worker at the time, and they just said, well, send her to an oncologist. Well, she didn't have insurance. She spoke very limited English. And I said, why are you thinking that she has cancer? You haven't ran a blood test or anything, right? And as it really turned out, she was dealing with, a lot of anxiety and acculturation stress from moving to a country where she didn't speak the language. And at that time, it just seemed like there was a need for education in the medical field, and just on all levels, nursing field, to understand what that could look like for different people. And I happened to be a social worker that was in there in that place, and I really could see it would benefit a lot of health paradigms or decision-making panels. I don't remember who was saying that, to have a social worker at the table when those kind of decisions were being made.
Well, thank you. And again, you're talking about the role of translating, not just from Spanish to English, but the language that the physicians and the nurses speak. That wasn't, so that is a big role that we have in lots of different spaces. So I just really want to thank all of you again. I'm just going to throw one more just global question. If you have any other thoughts about why the time is right for social work, I will put in a plug, and this is a little bit of a surprise because I didn't tease you up with this before. But we have midterm elections happening in the fall that are likely to have a big effect on our government, on our legislation, on our democracy. So I wonder if you could, in your closing remarks about why the time is right for social work, to also think about ways in which social work can make sure that every voice gets heard, that we really battle some of the voter suppression activities that have been sweeping this country, to make sure that we preserve a democracy, because I think social work as a profession is very rooted in the principles of democracy. So I'm just going to start with you, Yarneccia, if you would like to start. Any other thoughts about why the time is right for social work?
Sure. The time is right for social work because we truly want a better society, a better world for each other, our family members, our friends, our loved ones, everyone. And so I'll leave it at that so that my co-panelists have a chance to speak. But we want this to be much better. What has happened, especially in the last 2 years, has been unbelievable.
It sure has. Thank you so much, Yarneccia. Zander, any other thoughts about why the time is right for social work?
What I'll add is I want to hold up. Dr. Kim said something about bringing in faith-based organizations, and I really want to highlight that there sometimes can be an antagonism between social work, or people that are more into the activism part of social work and religion or organized religions. And so I want to hold up that we need to be working, I think, with these faith-based organizations, because our clients and patients are people of faith, of all different kinds of faith. And so working in interfaith settings, and just when I think about that, what it brings to mind is this, this issue, at least within Christianity, there is the concept of, that you're doing mercy or you're doing justice, right? And I think that social workers, we become social workers for many, many different reasons. And although all of us are inclined to be attentive to and attuned to the justice needs of the individuals we're working with, not all of us are social justice social workers. I just want to make that clear. I don't consider myself a social justice social worker, but I am a social worker who is attentive to the issues of justice. But I'm not pounding the pavement in the same way. I'm providing tools and strategies for my clients and patients, or I have along the years, so that they can do that work for themselves, right? And then I do it as a person who's part of certain communities for those efforts. But I'm more on the mercy side when it comes to my social work practice.
I appreciate you saying that, Xander. We all have a part to play and a really important role to play in this work. So I appreciate you making that distinction very much. Dr. Kim, Suki, would you like to share your final comments about why the time is right for social work?
I said a number of times, if not now, then when? And also I like to add to, if I am not doing it, then who is going to do it? The meaning is that we are all part of this, making sure that everybody's heard and everybody were taken care of. Because I like to say that whatever we make a decision, it is not impact only to myself, but also impact the people. So we cannot take our position so lightly, but we have to take our own position very seriously, because one decision actually changing the nation. So it is a time to practice with what we think in head. And not only for that, because I remember my old mentor that used to tell me, Suki, if we want to practice social work or teach social work, teach two things: how to use your mind critically, but also do not forget what you have in your heart. So it has to come together. Critical thinking is so super important, but we have lost a lot of compassion. We lost about the empathy. And this is the right time to bring it back. And that is where we came from. The social work is actually coming from the compassion and an empathy. And I am so humble that I become a better person today than yesterday, because I am a little bit better, I think. And I am hoping to be a good listener and be compassionate to the people who are suffering. So I like to bring that what we and what I make today really impact everybody. And I want to take my position very seriously. Not that very angry expression, but it is such a joy to do this work. And it is a hard work. It takes a lot of courage. We take a risk, and it is a time to take our own risk for rescuing people who we are working with, and we are working surround them. So this is the right time to do that. If I am not doing it, then who is going to do it? And I hope that you are the same. If you are not doing it, who is going to do this? And I am willing to take a risk, and it is the right time to do so.
Thank you. So the theme of this is going to be, if not now, then when? If not me, then who? I just really appreciate that, and bringing together, making sure that it's our head and our heart that are equally engaged in this space. Kimber, I'm going to give you the cleanup batter position here. Anything else that you would like to share as why the time is right for social work?
Well, that was just so touching. I carried that heart with me as well. So thank you, Dr. Kim. I think the time is right for social work to advocate for the needs of the most vulnerable populations, but at the same time recognize and honor the efforts of the social workers on whose shoulders we stand, right? You know, and it's also time for us as social workers to reach our full potential, right? The time is right for social worker to really expand and think beyond and innovate for that next level, but not forget the heart, like Dr. Kim says. So
Well,
thank you so much.
It has just been such a pleasure to be hanging out with the four of you this afternoon. I do want to now turn things over and our program. This ends our formal panel presentation, but there have been some questions that have come in through the chat. And so I'm going to turn things over to Andrea Murray. Andrea serves as the Senior Ethics Associate at NASW. She's responsible for developing ethics programming, as well as providing ethics consultation and technical support related to NASW's peer review process. Andrea holds an MSW from the Ohio State, you heard me, the Ohio State University, and a Bachelor of Science degree from the University of Toronto. Andrea, I'm just going to turn things over to you and your team to field the questions and pose them to our panelists. Thank you very much.
And thank you, Darla. Thanks for a wonderful and robust conversation to our fabulous panelists as well. So our first question comes from Karen, and she asks, can someone speak on the move towards having mental health and social work teams called to help people in crisis, rather than just having the police come who have limited training in these areas? Is there a model program that has been implemented from new laws in this area? I'm going to leave that open to anybody who wants to start.
I'll say a couple of things. One, I think I also endorse the idea of having social workers and other mental health providers going out on particular 911 calls where it's been identified that there's a mental health crisis going on. I think also sending them in tandem with police, because oftentimes people who are having a psychotic breakdown can be very dangerous. And so just in case, I think it's good to have the backup. I think that the lack of training can also be dealt with by having social workers or other mental health providers do those trainings. So bring more training. And I do know that there are lots of programs all across the country that are using not only mental health providers, but also chaplains that are specifically trained to work with the police. So I'll stop there.
Thank you so much, Zander. Those are some prolific comments. Anybody else want to follow?
I'm not on the panel, but I just wanted to draw attention. There was mention in the video of the 988 movement, and 988, for those of you that don't know, 911 is the emergency call. And that's why the police have been completely overwhelmed and ill-equipped to handle all the different kinds of emergencies that come into 911. So it's great, in my perspective, that social workers and other behavioral health workers are training and partnering with police departments so that we can more appropriately respond to those crises. But 988 is actually going to be dedicated to mental health concerns. And so it's going to take a little while. 911 is kind of hardwired into our brain. That's going to take a little while, but the more that we as a group of professionals can talk about the value of 988 and beginning to help people understand that there's two different numbers that you might call when you need some assistance, and just pause long enough to think about what kind of assistance. Now, there's going to be communication between 911 and 988. I mean, we've got to have that, but I feel like this is a really good movement, and there's been a number of us that have advocated for that for some time.
Absolutely. Darla, thank you so much for raising 988. I remember Kimber saying that mental health is health. And in our audience, we have Rick Barth, who shares that 988 is certainly needed, and social work will be a big contributor and beneficiary In the meantime, 211 numbers in many states are giving social workers a chance to interact with thousands and thousands of residents every day. We also have someone from the audience, Sam Reed, who shares that reimbursement is a huge issue, and thanks for mentioning that. I also wanted to shout out that we have audience today. I don't know if our panelists realize that you are the world. You are being viewed from Rwanda, from Kenya, and from New Jersey. So we just want to celebrate the world watching. Sam Reed shares that I think that the time is right for social work because now more than ever, greater emphasis is being placed on social conditions, social determinants, and social structures that contribute to health and well-being. This is true across academia, communities, and individual people. The energy behind social needs care now reminds me of the energy behind the social work at the dawning of our profession. That is profound. Do we have any comments or follow-up on that from our panelists? And that's fine.
I'll just say that what Sam was emphasizing was the social component. I noticed we have another comment from Matthew G. Watson about social work is primarily social. So it's like the emphasis on the social part of the social work that we do. And so that was really well enumerated, by that comment. So.
Yeah, and Matthew agrees. He says, very well said, Zander. Social work is primarily social, just as you said. And Matthew goes on to thank Dr. Suki Kim. If not us, who? The time is now for empathy and compassion. Kimber, thank you for suggesting we honor our social work heritage. We don't need to forget our past or judge our pioneers based on our reality today. And Dr. Dyson, I agree. We can do better than we have in the past 2 years. Thanks for sharing your perspectives. I know the audience has enjoyed so many just themes that pop out and resonate for me as I was listening to your panelists. So audience, I really want to welcome your questions as you think about themes around the pandemic, public health, social justice, and advocacy. The fact that the profession is serving as a voice that's always been there, but is being listened to. You've shared a lot about, social workers and the profession serving as a bridge. So I just invite the audience to continue to comment and share questions. Sharon Wilt says that the time is right to prepare our social work students for macro and leadership to address the wicked problems in society. Thank you, Sharon. So panelists, as you reflect on, some of the comments coming in and reflect on some of what you've shared, do you have any reflections as we close in terms of, what's on the table? And really, we talk about meeting the moment. We've talked about meeting the moment. Some people like to say meeting the movement. But as we plan ahead, we know that the time is right for social workers, but as we think ahead, as we always do, we're always prepared and proactive as a profession, anything that rises to fore as far as what we need to plan for.
I'd like to add, I want to acknowledge our next generation students. I invited the students to this roundtable. I don't know how many people joined, but I want to take an opportunity to acknowledge our next generations. What is such an honor to teach and also learn from our students as well in a classroom. And I really honor what they are doing for our community, because I was a student years ago and decades ago, but we just cannot say thank our students, what they wanting and hoping to learn more so that we can create community better than last year and much better next year. So I really thank you for joining, whoever were joined as a student in this roundtable today.
Thank you so much, Suk-hee. And
I was going
yes,
to hop
thank
in
you.
real quick, Darla. It's okay. I wanted to amplify the words of Professor Sharon Wilkes when she mentioned preparing the time is right to prepare social work students for macro and leadership to address the wicked problems. This is true. And as we, prepare, and Professor Wilkes, thank you for raising this point. Social work has to mobilize, the advocates for those that are wanting to do macro work, but as well as those that will step into the leadership roles, because those of us that are in our current leadership roles, we may not always be here. And for those of us that are in these roles, we have to also proactively want to train up, lift as you climb, which is one of my favorite mantras, of course, and prepare the next generation for advancing across these wicked problems. If we don't do that now and preparing social work students to do this, we're going to be having the same roundtable in another 20 or 30 years. And we don't want to have these same discussions in another 20 or 30 years. There was a paper that was written that was, it was published out of University of Houston in 1979. And if you look at the recommendations of that paper related to social work education, and you look at what's happening right now, it's mirrored the same way. There are the same findings. So the same things that they talked about needing to advance. They didn't call it equity back then. I think it was equality is how they defined it in 79, 43 years ago. It will look the same as it is now. And that's problematic. And so at this point, we really, really, truly need to hone in on preparing our students to be macro centered as well as micro, as well as those that are interested in leadership positions. So Professor Wilkes just definitely wanted to amplify those words.
That is awesome, Yarneccia. I'm going to turn it over to Darla as we see the close of our event.
Thank you so much, Andrea. And Yarneccia, you did a better job than I was going to kind of close things out. I was also going to amplify the need to really be thinking about leadership and stepping into leadership. And leadership is not a role, but a way of being. And so I feel like we need to be talking to our social work students and our young social workers about ways in which they could begin leading today. And sometimes leading is just asking the questions, why are we doing this? And not accepting, well, this is the way that we've always done it, like really pushing for the kind of change that we've been talking about today. So I just really want to thank you. Thanks again for the panelists. I just want to remind people that if you wanted to view that video again that we premiered here at the Social Work Leadership Roundtable, it is available on both NASW Facebook site and the CSWE YouTube channel. So check it out and feel free to let your friends know all about it. And now I'm going to introduce and turn things over to Dr. Scott Giacomucci. He is going to present some closing remarks to conclude today's presentation. Just a little bit about Scott. He's the director and founder of the Phoenix Center for Experiential Trauma Therapy and director of trauma services at Miramount Tremont Center in Pennsylvania, where he facilitates experiential trauma therapy, supervision, training, and mixed methods research. Scott teaches trauma-focused psychodrama as an adjunct professor and research associate at Bryn Mawr College Graduate School of Social Work and Social Research, and is an adjunct professor at Villanova University's Graduate Counseling Program. He serves on the Executive Council of the American Society of Group Psychotherapy and Psychodrama and is co-chair of the Research Committee. So thank you, Scott, for being willing to wrap this up, and I'm just going to let you take it away. Thank you so much.
Thank you, Darla. And thank you to all the panelists. I feel like there was so much that was said that it's going to be tough to tie it all together. I also want to thank the Leadership Roundtable, everybody watching, and everybody behind the scenes that you didn't get to see today, who really made this event happen. I'm really honored to be invited to close out this event. And I want to say that when it comes to leadership, I really try to approach the topic, the theme, in the spirit of humility, especially as a young person. Many people have far more experience than I do in this area, and I think humility is just so important for leaders in general. So my intent here is to echo some of the ideas from the video and panel and humbly add some of my own. The theme, the time is right for social work. As a trauma therapist, I can't help but see this through a trauma lens. The extraordinary increase in trauma and vicarious trauma that we're all experiencing with the pandemic, ongoing racial trauma, community violence, traumatic loss, substance abuse, interpersonal violence, and all the other forms of adversity. Some might argue that every person that we run into nowadays is a trauma survivor, not just our clients, but also our coworkers and staff, especially in the context of collective trauma. Social workers, we're unique in the way we address trauma and other issues in that we're approaching it from the bottom up and from the top down. We bridge the gap between macro work and the clinical work. And we do it all with an emphasis on that social part of social work that others were mentioning. Because we're wounded in relationships, we're wounded in groups and communities, the healing must also come in relationships, groups, and communities. Much of my own leadership philosophy has been influenced by my training as a psychodramatist as well. In my training as a psychodramatist, I learned the importance of action, of empowerment, of mutual aid, and what we call societry, or healing for society. Talking often isn't enough, as one of the panelists mentioned. We must take action. Talking so easily can become performative. Without action, all of the talk is meaningless. And I think this is true in every social work context, whether we're talking about clinical context, macro social work, activism, and in our organizations. Psychodrama's philosophy is to approach each patient, each client as a therapeutic agent for everybody else in the group, everybody else in the community. Psychodrama's learning theory suggests that we approach each student as an instructor in their own right. Similarly, I believe that we must approach each individual as a leader, as a co-creator. By doing so, we empower them to find their own strength, their own voices, and to be co-responsible for our society and our world. With the increase in trauma, it's important that leaders are embodying trauma-informed principles. And if you take a look at the trauma-informed principles and compare them to the social work core values, there's a whole lot of overlap there. Social workers have been trauma-informed practitioners from the start. In some of my forthcoming work, I'm proposing trauma-informed principles as ethical imperatives. And from my limited experience in the field and as a leader, I've come to realize that ethics is really the most important part of leadership. So many of the people that we're working with, clients, community members, and colleagues, have been harmed by people in power. We need more ethical leaders. So the time is right for social work. The time is also right for social work to address some of the issues within our own profession and continue to grow as a profession. When I was warming up to this kind of closing remarks, I did a little YouTube search to see what others had already said about the time is right for social work. And one of the things that shocked me was that there were a bunch of videos of people explaining why they left the social work field, highlighting some of the problems within our field that many people are working to address, and we need to do more to address. Just as we work to promote change within our clients, groups, and systems that we work in, we must also work to promote change in our own profession. There's ongoing issues that social workers experience, and the time is right to address these. If we're going to challenge systems and challenge them to address their own corruption, we have to challenge ourselves to work through our own shortcomings. If we're going to help others heal, we have to hold ourselves accountable for our own healing. And there's various other issues that our profession continued to experience. Many of them were mentioned by the panelists and introduced in the questions, things like telehealth policies, state licensing limitations. As a group worker, I'll throw in there the historic decline of group work education in social work education, while at the same time, the demand for group work and practice has exponentially increased. The rise in student loan debt and the cost of education, the norm in our field that social workers are overworked, underpaid, the burnout and vicarious trauma, the oppression and discrimination within our own systems, the oppressive work demands, documentation, productivity quotas, the way insurance impacts our work, and evidence-based practice, the limits of funding, gatekeeping. I don't know about you, but sometimes I just get exhausted from all the bureaucracy. So, of course, there's other issues facing social workers, and I really want to highlight that many in our community are already working to address these issues, and I encourage you to get involved. Like any other field, we have room to grow. And at the same time, there's so much that social workers offer society. The time is right for social work, and it's always been right for social work. Social workers play such an essential role in society as policymakers, as leaders, as educators, community workers, as activists, group therapists, case managers, advocates, and psychotherapists. Without social workers, I'm convinced that the suffering and dysfunction within our society would be exponentially worse. I tried to sit and imagine a world without social workers, and I literally couldn't imagine it. The time is right for social work. But is there really ever a time that's wrong for social work? And so, on behalf of the Social Work Leadership Roundtable, I want to thank each one of you for joining this event. And even more so, I want to thank each one of you for being a social worker and for all that you do in your community. So thanks for being with us. This concludes our broadcast.